Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster. My guest right now is Errol Pierre. Welcome to the studio.
Thanks for having me. Happy to be here.
The conversation we're having now is a preamble to a stage talk that's going to take place about Medicaid and how early stage startups can break into working with Medicaid populations and why that's important. So let's start, Errol. Tell me your title.
Yep, I'm the Senior Vice President of State Programs at a company called Healthfirst. We're the largest nonprofit health plan in New York State.
Okay. So before we get into how startups can and should work with Medicaid, give me a little bit of a bird's eye view of, well, an education on what Medicaid is and how it's changed over the last 3 to 5 years, particularly given the pandemic.
Yeah, great question. So there's over 90 million Americans that have Medicaid. Through the pandemic, more people signed up because, as you know, there was loss of jobs. And those loss of jobs, the safety net for Americans was Medicaid. You lose your employer coverage, where do you end up? On a Medicaid plan getting coverage so you can see your doctor. So the profile of a typical Medicaid member has changed vastly over the last 3 years because people who were PhD students, people who were tech entrepreneurs, they found themselves on Medicaid. Thank God that it was there so that they could actually still see their doctor during the pandemic.
I'm glad you said that because I was just thinking about what that profile is. What are some of the misconceptions that people have about Medicaid?
Yeah, one of the biggest ones is that these are people who aren't working. In actuality, 3/4 of the Medicaid population are working. They just happen to work for a company that doesn't offer them insurance, or if they do offer insurance, it's too expensive, even with the employer subsidy. That's a big misnomer.
What are the misconceptions that businesses have or startups have about wanting to work with that population? Obviously, it's a large population. They would love to trial their product, do a pilot. What are some of those thoughts?
Yeah, I don't think people realize half of the births in America are through Medicaid. So half of the pregnancies happening are through Medicaid. So if you're developing an app around maternal mortality and you're not thinking about the Medicaid population, you're missing half of the births. That's one. I think the other one is reimbursement. So people tend to feel like Medicaid reimbursement's lower than Medicare or commercial, which is true, but if there's a lot of patients that are healthy. So if you can figure out how to get the healthy patients, you'll make money on those, and then it offsets the cost on the sicker patients. So you have to think about having a balanced risk pool.
I'm guessing that patient mix is part of what's changed over the last 3 years as more people have gotten enrolled. So those preconceptions about how ill, chronic illness, that's shifting. Okay, so let's talk about strategies. Let's talk about how a startup, I imagine one of the challenges is, who do you call? How do you start? So what do you suggest?
Yeah, I think these conferences are great because this is where you're going to meet people, you can network. But the key is you're trying to solve the problem that Medicaid has. So if you look at the history of Medicaid, the biggest issue is dis-enrollment. Dis-enrollment, people fall off the rolls because they're healthy, so they think they don't need insurance, and then they only re-enroll when they get sick. So one of the key things that a startup can think about is engagement. How do I engage these Medicaid members so they're thinking about preventive care when they're healthy? That's like one of the biggest ones, right? And then the second one is social determinants of health. Sometimes a member wants to see the doctor, but transportation is an issue, or they live in a place that has high crime. So what are the solutions to overcome those barriers so that the members can get the care they need?
How could a startup get inside of your head or inside of the collective Medicaid head to understand what are the challenges that they're trying to address? Let's say that they really want to know, I really want to solve the problems of Medicaid, but I'm not sure who to talk to.
Yeah, so I think one is understand the population, understand the plans that are doing it, and then come with an idea of a blank slate saying, let me solve the issues you have, regardless of the population. The other thing is also remember, a lot of these members, English is not the first language. So you can't have a solution that's only in English. Or if you're thinking about technology, also remember these are low-income folks. They might not have access to internet or Wi-Fi. So some of these assumptions people make about who they're helping, you have to remember where they're coming from.
Do you have any examples of innovations that have been successfully integrated into Medicaid?
Yeah, absolutely. So there's one called Rubicon MD. There's a startup that actually got bought by Oak Street. They came in and said, specialist visits are expensive, so why don't we give the PCP an ability to have telehealth to a specialist? So rather than sending the Medicaid member to a cardiologist, I can actually get the specialist consult right there in the office. That saved the PCP money, that saved the Medicaid member another visit, and it just totally brought the solutions to the member. That met the member where they were, that met the PCP where they were. It was a beautiful construct. Yeah.
Thinking about your population in New York, what would you like to get pitched?
Yeah, I think right now, the biggest tidal wave that's hitting Medicaid is redetermination. So the public health emergency ended. Now people have to go back and recertify for their Medicaid
Define
coverage.
redetermination for me.
Yes, yeah. So these are like these jargon terms in the industry. We have to redetermine if someone's eligible for Medicaid.
Okay.
So you're eligible based on your income. If you make below $18,800 a year, you're eligible for Medicaid. If you're an individual, it's more for if you're a family of four. And we have to redetermine if you're still eligible. And you did not have to do that for 3 years. So Medicaid's grown and grown and grown, and now this is the first time we're redetermining their eligibility. And I would love to be pitched a solution that figures out how to do that, because I still don't know how I'm going to do it when it comes. Yeah.
So more on the administrative side. Okay, how to do that more efficiently. Anything else? Anything on the clinical side that you're seeing?
Yeah, so this is the other piece too, where we know there's a shortage of doctors, and when you add on top of it ethnic concordance, which is I can find a doctor that speaks my language or knows my culture, is culturally competent, the shortage is even bigger. So what are the solutions to get patients that want to see a doctor in their own language that's culturally relevant to get that care, because that's going to increase engagement too.
How are you thinking about the increase in the use of technology like virtual care when you're also thinking about social determinants of health, lack of access to computers, internet? Where do you see that trajectory going?
I think that's the future. So think about in-home care. It's cheaper to keep a grandmother at home than put them in a nursing home. So can we keep them at home with wearables and a TV screen where they can talk to their doctor or a nurse or anyone? That's so much more cheaper. So I think that's where the future's going. Now, when you think about the cost of technology, it's cheaper to give them an iPhone than the emergency room visit. I'd rather pay the iPhone bill than the emergency room visit. So we have to sort of change our mindset on cost, because that's an investment in their health.
Yeah, well, talk to me about that. How does Medicaid think about preventative costs that save money down the road?
Yeah.
I mean, is there a lot of thought going into, okay, if we spend money now, we'll save it later?
Yeah, if you start contracting in a value-based arrangement, so you say, I'm not going to charge you a PMPM up front, I'm going to get some of the savings on the back end with you. So I'm going to give them a phone, and we're going to avoid 3 or 4 emergency room visits. You're going to health plan. You're going to save $5,000, $10,000. I want half of that.
Okay.
You'll pay for the phone, and then the person will be healthier.
And Medicaid is in for that kind of deal.
So 80% of our revenue goes to a value-based arrangement like that.
Got it. Okay. So other strategies. Do you get pitched a lot?
All the time.
Okay.
All the time.
You get pitched a lot. What are some of the intangibles that you look for in a pitch? Obviously, it's got to hit a pain point, but you're also looking for the team and you're looking for the leader. What are some of the other things that you look for, and maybe a red flag?
Yeah. I'd say what I look for is that they have a diverse set of leaders that come from different backgrounds, so that they can really understand the patients they're populating with. Their ideas are robust, so you know that this is not the first time they're talking about the population. And they have a specific user in mind. So when I hear a pitch that says, we're making this to solve for Cecilia, and this is a 64-year-old woman who's on Medicaid, who has 3 chronic diseases, I'm like, okay, now I know they're thinking about it, as opposed to this broad population. But when you build for one, then I know that there was some thought in the construct that they brought up.
Okay. Any final words of advice to someone who wants to succeed in pitching to you and break into Medicaid?
Yeah. If at first you don't succeed, try again. A lot of times the reason why you don't get a deal has nothing to do about your pitch. It's just the time. Sometimes we already have too many in the pipeline. Sometimes it's not the right reason, so don't run away. Like, stay engaged. Every few months follow up and just keep the conversation going, and it might work.
Is there a time of year? Is there a website portal that they should go through?
Not time, it's a good, most health plans, if you're pitching to health plans, their budgets are done in October. So if you're talking to them October, it's too late. Okay. So if you're talking to them earlier in the year, then they can think about you in their budget for next year.
That's good. All right, Errol, thanks for the advice. And I hope that a lot more startups think in these terms, how to break into Medicaid, how to treat this population, because it's growing, it's changing.
And we need the help.
Yeah, it's helping a lot of people, and there are a lot of great startups here that can help you do that work. So thanks so much.
Thank you.